Have you been dealing with fatigue, brain fog, joint pain, and digestive issues that your regular doctor can't explain? You might be dealing with something called leaky gut syndrome. Stay tuned because today I'm going to share what this actually means, why it's so often missed in conventional medicine, and most importantly, how to recognize if this might be affecting you. Hi everyone, I'm Dr. Shura Babayan. As a holistic and integrative medicine doctor, I'm helping people who've been struggling with complex health issues find answers they haven't found elsewhere. My approach is simple but powerful. Connect the dots, find the root cause, restore your health. On this channel, I share insights that combine modern functional medicine with traditional Chinese medicine wisdom to help you understand what's really happening in your body and support you on your path to vibrant health. Let me start with something interesting I've observed in my practice. Often, when patients come to see me, they've already seen multiple specialists for seemingly unrelated symptoms. What's interesting is how these symptoms often connect back to one root cause: increased intestinal permeability, or what we call leaky gut. If you haven't watched my video, What Exactly is Leaky Gut?, I highly recommend checking it out first, link in the description, to understand the underlying mechanism of this condition. Now, you might be wondering, why don't all doctors recognize this condition? Let me explain something important about our current medical system. In conventional medicine, there is a strong emphasis on conditions that can be definitively measured through standard lab tests or imaging. Leaky gut or increased intestinal permeability presents a unique challenge because until recently we didn't have easily accessible tests to measure it in a clinical setting. Additionally, medical schools traditionally focus on treating diseases rather than investigating functional disturbances. This means many doctors are trained to look for clear pathology, things like ulcers, inflammations, or tumors, rather than subtle changes in how the intestinal barrier functions. They might acknowledge that intestinal permeability exists, but debate its role in causing systemic symptoms. Another crucial factor is that conventional medicine tends to specialize in specific body systems. A gastroenterologist looks at the gut, a rheumatologist looks at joints, a dermatologist looks at skin, etc. But when you have a condition that affects multiple systems simultaneously, it can fall through the cracks of this specialized approach. This is where functional medicine and traditional Chinese medicine shine, as we see these systems as deeply interconnected. The Chinese medicine perspective on gut health is particularly illuminating. In traditional Chinese medicine, or TCM, the digestive system is seen as the center of our body's entire ecosystem. They refer to it as the middle burner or the minister of the granary. Beautiful metaphors that describe its role in transforming food into energy and nutrients that nourish every part of our body. There is a profound saying in Chinese medicine: the spleen is the foundation of postnatal life. This means that after we are born, everything about our health depends on how well we digest and assimilate nutrients. The spleen system, which includes what we know as the gut barrier, is one part of the way how we view it, is associated with the earth element, which represents stability, nourishment, and boundaries. Nature offers us a perfect metaphor for understanding this boundary function of the earth element. Just as the earth creates natural boundaries for rivers and streams, preventing them from overflowing and maintaining their proper course, our gut barrier should maintain proper boundaries between what belongs inside our bloodstream and what should stay in our digestive tract. When these boundaries become compromised, what we now call leaky gut, it's like the banks of a river eroding, allowing water to seep where it shouldn't. When the gut barrier becomes compromised, TCM practitioners would recognize this as a disruption in the Earth's elements' boundary-keeping function. They observed that this could lead to what they called dampness, which is accumulating in the body, a concept that remarkably parallels our modern understanding of inflammation and immune reactions triggered by increased intestinal permeability. What's particularly interesting is how Chinese medicine recognized the gut-brain connection thousands of years ago. They understood that worry and overthinking could directly impair digestive function, and conversely, that digestive issues could cloud our thinking and affect our emotional well-being. This ancient wisdom aligns perfectly with our modern research on the gut-brain axis and what we know about the enteric nervous system, which I discussed in detail in my video about the gut-brain connection. You will find the link in the description below. Let me break down the main symptoms into categories that make sense. Digestive signs could be in leaky gut, bloating and gas, irregular bowel movements, either constipation or diarrhea or alternation, food sensitivities that seem to get worse over time, abdominal pain, indigestion. Systemic signs, fatigue that doesn't improve with rest, joint pain that moves around, skin issues like eczema or unexplained rashes, frequent headaches, unexplained weight gain or difficulty losing weight. There are also neurological and emotional signs like brain fog or difficulty concentrating, and here's this brain-gut connection, anxiety or depression, mood swings, poor memory, sleep disturbances. And I also want to talk about something cutting edge that you need to know about. Researchers have recently discovered a fascinating connection between leaky gut and what they are calling leaky brain. Just as the gut barrier can become too permeable, the blood-brain barrier can also become compromised. When this happens, substances that should never reach your brain can get through, potentially contributing to inflammation and various neurological symptoms. This discovery helps explain why so many of my patients with gut issues also experience cognitive problems, mood changes, and other neurological symptoms. It's a relatively new area of research that highlights just how interconnected our body systems truly are. I'll be creating a detailed video about leaky brain soon, as it's important information for anyone dealing with digestive and neurological symptoms. There are also immune system signs of leaky gut. Frequent infections, autoimmune conditions, this is a big one, allergies that develop in adulthood, this is a second big one, slow healing, anything kind of similar to that. In my clinical experience, I've seen leaky gut associated with numerous chronic conditions, including autoimmune disease like lupus, rheumatoid arthritis, and multiple sclerosis, skin conditions like psoriasis and acne, neurological conditions, mental health challenges, chronic fatigue syndrome. Now, I know some of you might recognize these symptoms and want to start treating yourself right away. But here's why that could be problematic. These symptoms can also indicate other serious conditions that need proper medical evaluation. Additionally, treating leaky gut effectively requires understanding your unique root causes, which might include hidden infections, environmental toxins, stress patterns, nutritional deficiencies, hormone imbalances, etc. In my upcoming videos, I'll be diving deep into the food sensitivities and leaky gut connection. If you're resonating with these symptoms and want to understand what's really going on in your body, I invite you to book a strategy call with me. The link is in the description below. During this call, we can discuss your specific situation and create a personalized plan to address your root causes. Don't forget to subscribe to my channel and hit the notification bell if you want to learn more about holistic approaches to gut health. I'd love to hear about your experiences with these symptoms in the comments below. Remember, understanding your symptoms is the first step toward healing, but true healing requires addressing the root cause, not just managing symptoms. Thank you for watching, and I'll see you in the next video where we will explore food sensitivities and leaky gut connection. Bye bye, see you soon.